One of the key issues, Dr. Sibal, and you're probably in the heart of it, is the rise in respiratory illnesses which have taken place in children within this age group especially, and that's taken place probably post-COVID-19. There's been a sudden surge. How much of it would you attribute to COVID-19 and, children now getting exposed to the environment? And how much is it due to environmental factors such as pollution?
Well, I think it's more about pollution than anything else. Of course, there's a group of children where they have a higher incidence of reactive airway disease. There's a history of asthma, allergy in the family, and that predisposes these children to get more attacks of respiratory symptoms. But that said, what we are seeing is the environmental pollution that's contributing to these little boys and girls really getting more frequent exacerbations of reactive airway disease if they have one underlying condition, or just going on where the AQ is very high. We encourage them not to go out. There's very limited cycles within the day. Usually the afternoon when these kids can go out, we encourage them not to play. We encourage them not to participate in outdoor activities because the fact that they're getting in so much of these pollutants into their young immature lungs, and the impact on young lungs is way more because they get greater exposure because of the way the respiratory system is in young children, and it matures over a period of time. And it's really, really sad that in certain parts of the country, during Diwali, where the pollution levels are very high, then the winter sets in, and because of the wind direction, because of crop burning, because of extra, pollution due to vehicles, because of construction activities, numerous reasons why, we are seeing more pollution than we should. And that is really responsible for the increasing incidence of respiratory problems. I think COVID came with its own set of problems, but I don't think we can attribute the increased incidence of respiratory illnesses to COVID.
What do you recommend on the same topic about antibiotics and giving antibiotics to children? How often?
Antibiotics are a very big stigmata actually in medical practice. Forget about pediatrics in any age group. And I think our use and overuse of antibiotics has led us to a situation where it's difficult to even discover and present a new antibiotic in 1 year. If you look at the graph, we used to have 20 to 30 antibiotics being discovered every year. It has petered down to one antibiotic every 5 to 7 years now, which shows that the resistance has increased because we have overused our antibiotics. So definitely, I think one of the rectifications is we should not use antibiotics indiscriminately. There has to be a reason. There has to be a proof that we are dealing with a bacterial infection, and the appropriate antibiotic needs to be used. The challenge there comes in is that you need time, because you need to get the culture sorted out, you need to find out other blood tests, which parents may or may not be willing for the same. So as a last ditch effort, you put in 3 days of antibiotics, overall culminating into a lot of antibiotic resistance and a disastrous endpoint to this.